Welcome to the Untethered Airway podcast, where airway health meets real-life impact. I'm Dr. Meggie Graham.
I'm Dr. Liz Turner.
And we're the moms and airway-focused dentists who founded the Untethered Airway Health Center. On this podcast, we're pulling back the curtain on the root causes of breathing and sleep challenges,
helping families and fellow providers understand how airway-focused care can change lives.
Because it's not just about teeth, it's about total body health.
Let's dive in.
Today we wanted to talk to you about our journeys and how we ended up where we are here together, sitting here chatting with you today. We both have two practices, and Untethered was born from within the restorative general dental practice and then became its own entity through just this kind of natural evolution of how we evolved in our own personal journeys and learning. In fact, earlier today on another podcast, I was talking about how the name of the practice started as Untethered Tongue Tie Center. I was really focused on tethered oral tissues. And while we still treat and think tethered oral tissues are very important, it's now called Untethered Airway Health Center because we understand that it's so much more complex and it's such a bigger picture. Liz, why don't you tell us your story?
So I'm so fortunate to spend so much time with Meggie. And if you'd asked me 5 years ago if we even knew each other, the answer was no. But we're two dentists essentially floundering on our own in the airway space. And we were so lucky to be brought together by a mutual friend who for years had been saying, you got to meet my friend who's a dentist. And we were like, we have friends that are dentists.
Plenty of friends that are
moms. No offense, it's just another dentist. But
and just because you happen to know non-dentist friend, just because you're dentist doesn't mean that we should be friends.
But then organically, our paths started crossing. And then we start to realize that, oh, that's the friend that she wanted to introduce me to. And it kind of became an instant best friendship and sisterhood. And it's been really fun to just get to know you over the years as a human, because we are so different, yet we're so passionate about so much of the same things. And so my journey started, I went to Tufts Dental School. I'm from Maine. I'm an East Coaster. I live in the West. So East Coast mentality with a West Coast vibe, I guess. I don't know. I was a general restorative dentist, but always focused on full body health. I'm a distance runner, recovering is what I say, because I no longer run 100 miles a week and my body's broken. But when we think about dentistry, it can so often be thought of as single tooth or in isolation and alone, because the mouth is separate from the body. And so for years, I was like, I'm in the wrong profession. And then I had a baby boy, and he was just kind of a cranky version of a baby. And I didn't really know much about them, but I just thought something's off. And turns out he had tongue tie. Turns out we had it treated, not in any of the systematic processes that I do now. And so much of our practice is built on the failures that we've seen amongst our own family. I wouldn't call him a failure. He's somebody who continued to thrive and do well post-release. But then I had another family member, my father-in-law, had a significant heart attack due to years of undiagnosed AFib. And it sounds really weird, but he remembers actually floating above his body in the emergency room as he had coded. And it's if we looked at some of the airway implications of his oral cavity early on, could we have changed the trajectory of his growth so significantly he may not have been dead on the emergency room floor? And so that's the question that I ask of myself and of our patients is, how can we optimize your particular system? And so I've become the advocate for, and what do you call it, Meggie? Almost for evangelistic.
Oh, we're evangelistic. We're out there spreading the good word. We want to just, it's either military or evangelistic. Like out there trying to take over.
You gotta put on the brakes when somebody asks about their kids snoring at a dinner party, because then
my husband will just give me eyes. Don't you even dare start talking about airway or breathing. Shut your mouth.
Oh, it's so funny. So it's been so fun to spread this message within my dental practice. And then as Untethered's grown and we've grown together, like here we are at a point where we're doing a podcast together. We have our course coming out. I just think the future is so bright for full body health. health and its relationship to dentistry. And it's something that as parents, I hope you find value in this podcast. As providers, I hope you find value, not just dentists, but say you're a lactation consultant or an ENT or a pediatrician. We want to dive into all the pain points that come with the controversy of airway health in dentistry. Every health space has controversy, but this can be something that is confusing and overwhelming. And we want to try to distill down the information as best we can.
It's controversial because there's confusion. And anytime there's something that lacks clarity, it becomes controversial for whatever reason. And I think that so much of it is just misunderstanding or miseducation. We have all been taught as providers of health to be compartmentalized in our own specialty. So we are technicians of the teeth, maybe we're technicians of the mouth, and there are body workers that are looking at how it all comes together. And then there's physicians that are doing different parts of the body. And so to be able to have this platform to talk to providers and to talk to families, our journey, like Liz said, was accidental and then just made a lot of sense, as most passionate soulmate relationships are. And I just found that I was very unfulfilled with single tooth dentistry. I thought I was in the wrong profession. I was putting out fires, and it just didn't fill my cup. I felt like it was just, I made the wrong decision. And through this journey and through connection with other really passionate dentists, I realized that being a dentist is not just fixing teeth. We have so many avenues of bringing our training into whatever we're passionate about. What did Jazz call it? Niche kebab.
Yeah,
Like,
niche
we get to
kebab. I like
add-
that.
Just take what we like and add it to our kebab, and then take something off the kebab we don't like. I love that phrase and that mentality. We get to create our profession in a way that resonates with us and therefore is even more specialized for our patients.
And like you said, it's controversial because there's confusion. So often in medical school and dental school, we're taught that we're the best, that we're the answer, that we should be confident in our diagnosis and our treatment. The hard thing is when we don't know, we need to be okay with saying it to patients and then referring to somebody who does. And I think
Right.
one of the biggest pain points is general health pediatrics. These are incredible providers who do an incredible job of keeping our kids healthy. But when it comes to preventative medicine, it's not as much their scope because they can't have all the answers. The bandwidth to have all of those answers for reactive and preventative medicine, it's not possible. Nobody's that smart.
It's not possible. And like you said, we have to be comfortable saying, I don't know. And I ended up having so much more respect for providers that say, I don't know. But
let me find you who can.
Let me find a group that can help us, or let's collaborate and figure out a team. Because when a parent says, if you didn't know something and you had that arrogance that we were all planted with in grad school or medical school of we have to know, you don't want to say I don't know because you're afraid that you're going to be less respected. And so you might say to a patient, well, that's not a big deal. They'll grow out of it. Don't worry about it. That's not a thing. Just because you don't know about it doesn't mean it's not a thing. So instead of saying no, say, I don't know about that. I'm not aware about that. Because as soon as you say no to a patient, that has planted a seed and can now put them on the wrong trajectory to getting information and help that they might desperately need.
Totally. And I think that's the biggest thing. And this is what I share with families is like, I know I'm so sorry that you've been asking questions of providers about this for years and you feel like you've not gotten answers. You finally found us. And at that point, oftentimes people are crying. There's tears, they're welling up. There's lots of tissues around just because I think when we have families who are trying to do the best they can for either themselves, but especially their children, and they've been asking questions for year after year to provider and been dismissed or gaslit or even told they have Munchausen's by proxy was one of the ones.
Oh my God.
Absolutely inappropriate accusation. It's a horrible story.
We could have a whole podcast on all the inappropriate things you've heard that other providers have told patients.
And so that's what I tell families is like, and this is one I heard yesterday. I asked my pediatrician and they said it's not the worst they've ever seen, so we don't need to do anything. In what space do I want my kid to be the worst someone's ever seen?
I'm only going to
before I
treat
seek care
on that scale.
And so they do a beautiful job of keeping kids healthy. And I tell my pediatricians, I say, you want to talk about it yet? And he goes, I'm not ready. And I go, so then we come back and I go, you want to talk about it yet? And he goes, I'm not ready. And
Well,
one day I hope he'll say he's ready.
we do that with
So
patients too, right? We
yeah.
learn how to plant seeds. And so the process that we've gone down as individual providers and then now as a team and partnership, we are so excited to share it with you all as listeners and watchers, as wherever you are in your journey as a parent, as a provider.
And
So,
what's so fun is so many of our patients find us through a podcast, whether it's one that we've done or they've listened to another health podcast where airway health came up, and then they seek us out. I had a woman yesterday who came for herself who has twins, and she goes, I need to bring my twins. And I go, when you're ready. And the hard thing is she'd been asking questions about herself because she was feeling so bad. But now, because of the knowledge that she learned in a 30-minute consultation, she's starting to ask questions about her family as well. And so our hope is to be a resource and a bit of a guiding light and maybe a bit of a myth buster and a an explosion of knowledge to families and providers so that we can help guiding the process of treatment forward.
and
Um,
as absolute CE continuing education junkies and lifelong learners who find that our cups are filled by learning more and more, we promise that we're going to continue to evolve as we learn more. We want to do better. In fact, in my office wall, there's pictures on social media and on my website, but I have Maya Angelou's quote about do the best you can until you better and then do better. And that's kind of our philosophy too, is we want to be the forefront of our knowledge to everyone else. So if you follow along with us, we promise we'll keep learning with you.
we're going to do deep dives into different topics. We're going to start bringing on some guest lecturers. We were just on a podcast in the UK. It's 7:50 where I am now, but I started podcasting at 6 a.m., 1 p.m. UK time, 7
Can
a.m.
you believe this is
CST
our life
time.
now? This is what we get to do for work.
Well, half of my battle is trying to figure out time zones. I can't tell you how many times I plugged that in because I was like, is it 5 a.m. or 6 a.m.? And then I didn't sleep. And also, I'm really excited about the prospect of sharing patients' journeys. So, as a parent who's listening, if you feel like you have a journey that you could share and we'd love to hear it and maybe have you as a guest on the podcast. I think that's where the most change has been made the most rapidly, in my opinion, is the social media and the ability of moms to feel open enough to share their
Yeah.
stories.
The savviness of our patients, right? Medicine
Yeah.
is delayed and not up to speed for our patients, but the savviness of patients and the education that they're gathering and the demands that they're making to seek answers to what they know is a problem is really powerful.
And for so much of our society where everything's perfect on paper, everything's perfect in the Instagram filter versus reality, the filtered version is everything's fine. But I think families being willing to share the reality version of their breastfeeding journey, their starting solids, their sleep journey of their 3-year-olds, their own personal health journey, that's where change has been made rapidly. And I think it's hard because providers can't keep up as fast as the mom army is coming at them. And they should. Like, and this is what I tell families all the time. If you're not ready to hear what I have to say, I want you to get a second opinion from this person and this person, and then compare all three and say, where do I feel the most supported? And I think as parents, we should be willing to seek second opinions, and we're entitled to them because we're entitled to all the knowledge that's out there. So I hope that we can bring that to you guys.
Yeah, absolutely. I think that that's such an important thing to consider is that not one provider is ever going to have all the answers, and to follow your gut and find somebody that can listen and hear you and help guide you, even if they don't have the treatment modalities. One of the things we said earlier today was what I think makes us special and Untethered, the practice as a superpower, and then hopefully the Untethered way as an educational avenue, is that even though we might have treatment modalities to offer our patients, that might not be the first step. And so where we come in is we can really help quarterback and look at the big picture and guide, or you use the phrase decision tree, and help patients get really individualized approach rather than handed a recipe and told this is what works for everybody. There's a big prominent ear, nose, and throat group in our area that has done an amazing job as far as creating awareness about the importance of nasal breathing. That's powerful. That's wonderful public service. And their patients go in and all get the same treatment. They're all getting the exact same treatment, and it lands on the patients that require it, and they hit the lottery. And for the other patients, it was the wrong diagnosis of the wrong treatment. And so, really understanding the nuances and understanding how complex this can be and how many different avenues there are to correcting breathing issues is so important.
And oftentimes, what we'll say to patients is there's low hanging fruit and there's stuff that involves a lot more time, energy, finances, commitment. We want to start you in a place where you feel like you're gaining ground in the health journey. But I also want you to know that there are other things available to you.
Right.
So we'll go through the whole spectrum where we feel that treatment would be appropriate, but then tell them that there can be other options that are available if A, they don't need them yet, or B, they're not quite ready to do them, especially for a lot of our patients who are moms and they want to help themselves. They say, you know what? I had a consult 5 years ago. I know I need jaw surgery. I just can't do it yet. I've got 2 kids at home. Money's tight. Time's tight. I don't have the bandwidth to do this much for myself. What else can I do? So there's always options to help people feel better. It just may not always be the end goal. So I think we're really good sounding boards for people. We're really good listeners to what people's goals are, because at the end of the day, you can tell somebody they need jaw surgery, but if that's not going to help them with their chief complaint, then they're not going to do it. So
Yeah. Meeting people where they are. And I think that that's so important. Hearing them. What are your goals? Here are the options. Here's what's possible. But if that's not there, that doesn't mean you can't do anything at all. I think what makes us special as well as a partnership is that there are so many avenues to learn more, to seek out opinions, to get care, to get education. But what makes us, I think, really special is that we are two moms, and there's no one more passionate about health for their own kids than moms, especially when they've seen their children suffer. We are general restorative dentists, meaning that we see the end of somebody that missed optimal growth and development and function. We're putting out fires. And then we also see patients across a lifeline, right? We start with treating infants, but we also treat patients in their last decades of life. And so we have a really holistic, comprehensive view of the lifespan and how all of these things present at different stages of life. And I just think we have a lot to share, and we're excited to have the opportunity to share it.
So I call it womb to tomb. If we can start diving in, and Meggie calls it babes, littles, bigs, we can compartmentalize these age groups and really dive into some topics in each. And I think we'll continue to do that. We'll provide some broad overview stuff of each age group. And then we'll also segment out little symptoms, because I could talk about reflux in a baby and reflux in adult each for an hour. And not everybody needs to or wants to hear that. But when you're ready, we're here for it.
That's a really good point. What do you want to hear about? We're so open to diving into topics that matter. We have so many things that are important to us, but we want to hear what's important to you. So shoot us a DM or comment and let us know what topics you want us to get into, because chances are it's going to interest us too. So we're happy to talk about it.
Should we call it?
Let's call it.
Well, thanks everybody for joining us on episode 1 of the Untethered Way podcast.
Follow along. We're excited to whatever we are excited to do. We're excited. Have a great day.
Thanks for tuning in to the Untethered Airway podcast.
If today's episode helped you see things differently,
Please share it with someone who would benefit from hearing this. And don't forget to subscribe.
want to learn more about airway health or connect with our team?
Please visit our website, untetherederwayhealthcenter.com, or follow us on Instagram @untetheredairway.
Until next time, bye.